My name is John Christensen. The name of the invention is Sensastep. I started off as a patient after suffering a traumatic injury to my left leg and became an inventor with the help of two really smart people, Richard Hazelhurst and Steve Willens. We developed a device to allow people to walk as normal as possible after suffering many different types of injuries. Sensastep was developed primarily for me to be able to walk and continue doing my job. At the time, I was a ship captain. And we have found out in a lot of research and development that it allowed me to walk, and it is our goal to help millions of people with balance issues, traumatic injuries, anything that affects the normal walking. Sensastep, I feel, is a very common sense solution to a very complex set of problems facing many people. How Sensastep is actually put together and what it actually does. We started with an Insole, which is reversible left or right foot. It has 13 sensors. They are placed so as to allow a signal whether you're walking on soft sand, on the grass, climbing a ladder, any normal day-to-day, stepping off a curb, stepping on some debris on the street to keep you from falling. The signal is transmitted to a receiver worn around the ankle, which wirelessly transmits a signal to the earpiece, and the brain picks that up through the frequency of the heel and toe signals, which are interpreted by the cochlear nerve. The brain takes those signals and does all the work for you. There's really no learning curve with this at all. What's unique about Sensastep? To my knowledge, it's the only extraneural pathway device presently available to patients. My leg was initially severed at the knee and had suffered tibial nerve damage. The only prescribed treatment for tibial nerve damage is amputation. After we've developed this and all the R&D and the testing that we've done, not only does it allow me to walk normally, but I've been able to avoid amputation of this left leg. And this could be key for many people around the world suffering any type of tibial nerve damage. So I think the extraneural pathway is what makes this device unique.